Yellow fever continues to pose a significant public health threat in South America, with Colombia recently declaring a sanitary emergency due to a surge in cases that have already led to 34 deaths out of 74 confirmed cases across the country. The outbreak, which is transmitted through the bite of infected mosquitoes, has triggered alarm across the region, particularly in countries like Peru, where a similar epidemic is unfolding. The World Health Organization, WHO, and the Pan American Health Organization, PAHO, have warned that the risk of yellow fever outbreaks is currently high across the Americas, especially in endemic regions. The situation is alarming, not only because of the number of deaths but also due to the rapid spread of the disease, suggesting that there may be more severe outbreaks in the near future. In Colombia, health authorities have mobilized over 8,000 healthcare professionals to enhance vaccination efforts, targeting both residents and travelers. The government has also enacted stringent measures, including requiring vaccination certificates from all individuals entering or leaving the country. This move indicates the seriousness of the crisis and the urgent need to contain the spread. While Colombia has a sufficient stockpile of vaccines, the pressure on the healthcare system is growing, as millions are being urged to get vaccinated in a bid to stop further deaths. However, despite the concerted efforts to contain the outbreak, the problem remains widespread, and health experts are warning that the situation could worsen. Yellow fever cases have been reported not only in Colombia but also in several other South American countries, including Brazil and Peru, where the numbers are equally concerning. Between weeks 1 and 12 of 2025 alone, more than 130 cases of yellow fever were confirmed across the region, resulting in at least 53 deaths. While the vaccines are a crucial part of the prevention strategy, there are serious concerns about the availability and distribution of these vaccines, as well as the fact that many of the recorded cases have involved individuals who are not vaccinated, raising questions about the effectiveness of current public health campaigns. In Peru, the number of yellow fever cases has surged compared to last year, with 19 cases confirmed by the Ministry of Health as of the 11th week of 2025. The disease has primarily affected men aged between 8 and 44, many of whom belong to indigenous communities in remote areas, which raises significant concerns about healthcare access and the ability to reach vulnerable populations. The majority of cases have been reported in the departments of Huánuco, Amazonas, and San Martín, areas that have been under ongoing threat of outbreaks since last year. The fact that yellow fever is reappearing in these regions despite years of efforts to control it points to systemic issues in public health infrastructure and the need for more sustainable and targeted interventions. Historically, South American countries like Brazil and Peru have been the hardest hit by yellow fever outbreaks, accounting for a significant portion of cases and deaths in the region. From 1960 to 2022, Brazil reported over 3,400 cases, while Peru followed closely with over 3,200. These figures not only illustrate the persistent nature of the disease in the region, but also highlight the difficulty in eradicating a virus that thrives in tropical climates and can spread rapidly through mosquito populations. The threat of yellow fever is compounded by the limitations of healthcare systems in certain areas, particularly rural and remote communities, where access to vaccines and medical care is limited. Despite widespread awareness campaigns and vaccination efforts, the disease continues to claim lives, especially in areas where populations are either unvaccinated or inadequately protected. Additionally, the lack of adequate surveillance in these regions makes it difficult to detect and respond to new cases in a timely manner, leading to further transmission and loss of life. The ongoing outbreaks have also sparked concerns about the economic and social impacts of the disease. In countries already struggling with economic instability, the resources required to combat yellow fever outbreaks are straining public health systems, diverting attention and resources from other critical health needs. The cost of these outbreaks, both in terms of lives lost and economic disruption, is substantial, and it highlights the vulnerabilities of countries in the region when it comes to handling infectious diseases. While the yellow fever vaccine remains one of the most effective tools for preventing the disease, its distribution is not always equitable, and there are ongoing concerns about vaccine hesitancy. In addition to vaccination, experts emphasize the importance of vector control measures, such as eliminating mosquito breeding grounds and using insect repellents. Yet, these efforts are often undermined by insufficient infrastructure, lack of public awareness, and environmental factors that facilitate the proliferation of the mosquitoes that transmit the virus. It is important to note that the situation is far from being under control, and the challenges faced by Colombia, Peru, and other South American nations in managing yellow fever are a stark reminder of the persistent threat posed by infectious diseases in tropical regions. While immediate measures like vaccination campaigns and travel restrictions are vital, long-term strategies that address the underlying issues, such as strengthening healthcare systems, improving disease surveillance, and promoting widespread public health education, are essential if the region is to mitigate the impact of future outbreaks. In conclusion, while the efforts to control yellow fever in South America, including mass vaccination campaigns and heightened awareness, are commendable, the reality is that the risk of further outbreaks remains high. The lack of vaccination coverage in some areas, the insufficient healthcare infrastructure, and the persistence of the disease in certain regions all point to a larger issue in public health preparedness. As yellow fever continues to pose a deadly threat, it is crucial that countries in the region prioritize sustainable healthcare reforms and ensure that vulnerable populations are adequately protected. Without these systemic changes, the battle against yellow fever will remain an uphill struggle, and future outbreaks may only become more severe.